It is a night of festivities with Dr. Lizardi, Dr. Prasad, and Dr. Rosie. So guys, hold on to the edge of your seats because you're definitely in for a treat. So here's our disclaimer. It reads as follows. These statements and comments have not been evaluated by the Food and Drug Administration. This information is solely for educational purposes only and includes recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. However, Engage's products are formulated to address nutritional deficiencies and supply the body with the required nutrients. Also, it is important to note that nothing here is meant to substitute for professional medical treatment or consultation with your primary healthcare provider. So, Ms. Corleen, with that out of the way, I'm sending it back over to you.
So here's what we're going to do, Dr. Prasad. We're going to bring up our additional speakers for tonight. We're going to let them talk a little bit.
Sure.
Then I'm going to come back to you, and then we're going to tell us about the products, okay?
Sounds good.
First, I want to introduce Dr. Jose Lizardi. Dr. Lizardi. No, Helen's supposed to be doing this part, right? Or am I forgot. Okay, we messed up. So Dr. Lizardi, here's what I want you to do. First, thank you for saying yes. Thank you for being here. Talk to us. I think, are you muted? Unmute yourself. You're unmuted. Okay. Talk to us about your credentials. What have you done in your life? You're an OBGYN. People were real excited when they said the OBGYN. So tell us about Dr. Jose Lizardi.
Yes. First of all, I'm humbled to be in the presence of the omnipotent people.
And being the one to avenge this growing problem. And
I think that's Dr. Prasad. Okay. Wait a minute. Okay. All right, go ahead.
Yeah. I've had the privilege of doing medicine for 44 years. I did OBGYN for 32 years of my life.
Okay.
Delivered 7,000 babies, 10,000 surgeries, chairman of the department. I mean, I can go on and on and on and on. And it's been the most rewarding experience in the world. Right now, I'm a board certified anti-aging regenerative medicine specialist in Tampa. And what we do is very simple. We just change the model and we look for the root cause of the problem. And the reason I get involved with Engage Global is very simple. It's a top-notch product, it's second to none, and it addresses the micronutrition of people. And it's a simple fact, you cannot get better and optimize your health without fixing your nutrition. We live in a very toxic world, and we need something to remove these toxins and replace them with what the body needs. And this is exactly and precisely what Engage Global products do for me in our practice. We see one miracle after the next, after the next, after the next. But I always emphasize, you have to fix yourself from inside out. It doesn't work the other way. It just doesn't. If somebody comes for the magic pill in my office, there's the door. We just don't bother because we have to take responsibility. We have to change our lifestyle. We have to supply our body with what it needs. It's in the Bible, for God's sake. Give your body what it needs, and it'll fix itself. And it does. It really does. To this day, I haven't met a single patient with quote-unquote perfect nutrition. So in essence, what I tell patients in our office is very simple. We have to fix your nutritional deficiencies, and this is the best product on the market to do it.
Very good.
I specify, and this is crucial, it is the only product line with 7 patents and 14 scientific studies to validate that they do what they claim that they do. No one can say that. There's 80,000 products out there. This is the only product line that claims and has 7 patents and 14 scientific studies to back it up. It's as simple as that. Facts don't lie, okay? All right.
So Dr. Lizardi, let me do this. Let me introduce your cohort tonight, Dr. Rosie Milligan, because Dr. Rosie Milligan, we're going to have a great conversation with these 3. So Dr. Rosie Milligan is a person that I've known for about 15, 20 years now. She is a community activist. She is a community leader. She a true entrepreneur, loves people, is just an influencer. And so she's going to come up and talk to us briefly, and then we'll get a good conversation going. Dr. Rosie, tell me why Micro Daily, how I finally got your attention with Micro Daily.
Well, one of the reasons, because I realize how important it is to feel good, to feel well, not just feel good, because you can feel good with stuff that's not healthy for you. But I realize I see so many people that's non-productive because they're not getting the nutrients that they need. You know, when you're dehydrated, the body will, you'll be thirsty. The body, God has designed the body to really to function in the way it should. So when you need water, you feel thirsty. So I've learned that a lot of people eat all day, become obese, and many other things that sometimes lower their self-image. It's because the cells are crying for food. It's crying, it's crying out for nutrient. It's saying, I need something to make me whole. I need something to make me feel better. And as a relationship expert, and as I counsel so many people, and a lot of their problem has to do with the fact that they're tired because they don't have the nutrients that need in their body. And when people are tired and not feeling well, you cannot embrace a wholesome relationship when you're not feeling well. And I think if there ever was a time for relationships to get strong, it is now, because now it needs to be so strong that, Corleen, I'm telling people who are not married, they need to go find somebody and get married. I'm telling those who are married, you find a way to stay in it, because I'm telling you, it takes two. In fact, it takes, I would say it take three, but you know, they don't allow that in this country. I'm talking about polygamy. So don't y'all go off. You know, I'm just me. But you need good relationship. And what I've found that people who are economically challenged, who can't get on that yacht on the weekend, who can't take that cruise with you, Corleen. Sometimes people who are economically challenged, the only thing within their reach is to have that intimacy and to be able to have a good love-making experience. And believe it or not, people have never tied nutrient into their bedroom. So nutrient from the bedroom to the boardroom, I find that is critical. So that's why I am passing the word on. Because when you are sexually satisfied and happy, you are a better employee. Oh, I'm serious. You're better.
Okay, Dr. Rosie, just
no,
let me
it'll pass everything that you do. I'm just being real. Come on, folks.
I agree.
All
I
right.
agree with you.
I'm gonna
So
shut up.
look, okay, so I mean, Dr. Prasad is gonna come on and talk about his products. But before we do that, I want to tell you why I thought this would be such a great call. So if you're a guest, we're gonna tell you all about the products. Don't worry. But I'm gonna fast forward. We had a new product that was introduced, and it was called Heart Boost, right? And Heart Boost, people were having great results. And men were really having great results. They were talking about increased blood flow. They were talking about circulation. And so I decided to look, at women's statistics. And it was like heart disease is the number one killer for women. Okay. Our rates are so high. And then I started thinking, well, okay, so now we have all these men that are happy. Well, what about women? And then I thought about Dr. Lizardi. I was like, well, wait a minute. We need to see how we can have healthy bodies for men and women, and then we can have healthy relationships. And that's why it was so important that we just didn't do a call for women, that we did a call for both. And Dr. Lizardi, listening to you and Dr. Rosie talk earlier, I think everyone is going to absolutely enjoy this call. And Dr. Prasad, I'm going to say to you, when you were thinking about creating healthy bodies, I wonder if you said, wow, it's also going to create healthy relationships. So we're going to let Dr. Lizardi and Dr. Rosie have their They're going to have an interesting conversation because Dr. Lizardi is going to talk to us about women's bodies and how they change, and then how we make this better for everyone. So Dr. Lizardi, I'm going to remove myself from the screen, and Dr. Lizardi and Dr. Rosie, let's have the conversation.
Okay.
Start, Dr. Lizardi.
We had a brief introduction to the subject, and basically humans are humans, and we both have the same circulation, both men and women. It's a simple fact. And the most important thing which I see in my office is poor circulation. And I want to emphasize, when a man comes with ED, that's just the tip of the iceberg. You better look for something else under the hood, i.e. cardiovascular disease, poor circulation, and a potential cardiovascular accident, okay? I see people at 24 years old who cannot get an erection. I see people at 26 with testosterone levels of 300. So yes, you can fix the testosterone. Yes, you can give them a little magic pill to get an erection, but you're being irresponsible if you don't look for underlying circulatory problems or cardiovascular disease. And it applies both to men and women. And I used to see this 40 years ago in the 50, 60, 70-year-old people, and I don't. I see people at 25, 24, 26 on steroids having these ill effects. So what is the response? Is the response another pill? Well, yes, engage global. I reemphasize, I go back to square one. You have to fix the inside first. If you don't do that, it's not going to work.
Absolutely. I definitely agree with that. In relationships, sometimes we find that men would stop off to shoot pool or to do anything that they can find to do
Yes.
versus coming home, particularly when they find themselves with impotency problem, because they want to make sure that the woman is asleep when they get home, because they don't want to face the fact that they're not able to perform. So now you have relationship problem. This woman thinking you hanging out with another woman, you hanging out shooting pool. You just don't want to come home because you know what's going to happen. And the same thing, women have their way of doing things because most people don't think that women are impotent. There are a lot of women who they will have sex at the drop of a hat just to secure marriage. And because sex is not what they want, they don't have the drive, they don't have the feeling, and they have circulation issues too, diabetes and many other things. So
Right.
what they would do, they would be freely with sex, but on the honeymoon night, that's when they close their legs
Exactly.
because they have consummated that marriage. So it's so important for us to talk about this until we have a person healthy from the inside out, every aspect of their body, you are going to have some real issues. That's why we have all this sexual molestation and different things just destroying our cities, our churches, because people fail to deal with this little three-letter word. And women, sometimes when they have problems with their menstrual cycle, they may go, I've heard women say they go 7, 8, and 10 days. Well, they have an issue with that, and they don't know how to talk about it to their husband. So it's critical that we know what we need to know about men, and that men know what they need to know about women. Then they can embrace us. Then they can understand that during those times that you're not conducive to sex, they will understand how intimacy comes into the play. And you need energy now, folks. If you think sex doesn't require energy, I don't know who you've been in the bed with.
Okay, Dr. Rosie, hold on. Hold on. Okay, Dr. Lizardi. So let's talk about women and their bodies
Yes.
and all the things that we women go through and understanding when our bodies start changing. I know today we talked about, a couple of conditions that women have. We have a couple of testimonies, but let's just explain our bodies to us, please.
Couple things. Average age of menopause is 51.4 in this country. But the problem is that hormonal changes begin on average at about 32. So this is what I see in the office all the time. I'm tired. I don't have libido. I don't feel well. I don't do this. I don't do this. I don't do that. I'm only 34 years old. They're not menopausal. The incorrect assumption is that nothing is going on with their hormones, and that's totally wrong. If somebody has those problems at 32, it is in your best interest to check their hormones, okay? And this is the reason. At about 32, estrogen and progesterone start to change. Progesterone drops, estrogen stays where it was, so you have a relative estrogen excess. Most of female problems are due to estrogen, in my professional opinion. Some people may differ, but what I see in my own practice is progesterone's down. Estrogen doesn't necessarily go up, stays about the same, but you have a relative estrogen excess as opposed to progesterone. The typical response is, it's all in your head. This is not true. I'm going to give you an antidepressant or an anti-anxiolytic, or I'm going to send you to a psychiatrist. I can't even tell you how often I see this scenario, okay? And I can tell you others, like for thyroid disease, for example. The wrong test is done, the incorrect test is done, you're told that the thyroid's normal, and you have textbook clinical signs of either hormonal changes at 32 or thyroid changes at 32. So that's one thing that I wanted to emphasize, that hormonal changes begin at 32, sometimes earlier than that. So you can't go by the menopause at 51 business, okay? Number two, women and men don't feel well, okay? And if you don't feel well, you're not going to have libido, you're not going to enjoy yourself, you're not going to have energy. And what is the root cause of all this? In general, nutritional deficiencies, okay? I can't emphasize that enough and enough and enough and enough. Lifestyle changes and nutritional deficiencies will basically fix this planet, okay? But we have toxicity, we eat the wrong things. Every commercial on television is something plastic or something processed. So we need to fortify our bodies with targeted nutrition, i.e. micronutrition. And the word micro refers to the fact that these molecules are so small that they can actually go into your mitochondria, which is your energy powerhouse, and feed the mitochondria so that you can have the energy and the ability to compose yourself the way that you're supposed to. Okay?
Okay.
You
Very
talked
good.
you talked about when women start maybe seeing this change at about 32. Men start seeing their change at about what age? Because people think, unless you 60 or 70, but you're talking about younger men now. Because I had a young man that came to me, doctor, and he said to me that he needed some product to boost his sexual stamina. I said, well, I said, he was 22 years old.
Yes.
And I said, well, why are you saying this? He said he could only last 30 minutes. But women keep asking me where he is.
Yeah.
Anyway, I said, but I said, how did you learn about sex? He said, well, his daddy taught him to watch pornography. I said, that's scripted. That's a movie.
Yeah.
So we really need to understand that. And when I counsel, I've had women, just like you were saying, who have low libido, who don't have the energy, who are not feeling well. And they have said to me that they could be watching TV or doing things. When their husband, when he drives up, they jump in the bed. I'm serious. They've told me that. Cover their head and pretend that they're asleep because they're not conducive to intimacy nor sex.
That's sad. That's pretty sad. Or a
Yeah.
head or something else. In general, I see, this is my own personal practice and some statistics, and it all depends on what you read and who you read. 30 to 32 for women and mid 40s for men, okay? However, is highly variable. And as I said before, I see them younger and younger and younger. Look at when women had a menstrual cycle before in the past. 16 was menarche when they had their first menstrual cycle. I had an 8-year-old menstrual,
Wow.
for God's sake. And it's usually estrogen. I keep emphasizing that. Estrogen exposure from what? Plastics, plastic is number one. Lipstick, perfume, colognes. Read everything before you put something on your body, before you're exposed to that something, okay? Right? These estrogens will really, really confuse and completely throw off your endocrine system, okay? They toxify your endocrine system, so you start having menstrual cycles at 8. Most people with cramps, most people with heavy menstrual cycle, most of these women is simply estrogen dominance, okay? All right? But what's the first thing that is done? They get put on birth control pills, okay?
Yes.
And I'm an OBGYN. I did it for 32 years of my life. I saw in my career 500,000 women, that's 500,000 women, time after time. Mood, libido, cramping, heavy menstrual cycle. It's usually a couple things: a nutritional deficiency, a hormonal imbalance, or your thyroid, okay? And if I'm allowed, I'd like to talk to you about thyroid for a couple minutes because it's so critical. The normal testing for thyroid is a TSH and a T4. T as in Tom, S as in Sam, H as in Harry, TSH, and a T4. In reality, that's a myopic, inconclusive, and insufficient way of testing your thyroid. So this is what I see in the office. I'm losing my hair. I don't have libido. My menstrual cycles are all over the place. I hate my husband, okay? I'm gaining weight. I can't control my weight. That's a textbook thyroid patient, okay? Yet the TSH and the T4 are normal, okay? So because the lab works normal, the doctor forgets to look at the clinical picture and misses the whole boat and tells the patient, quote unquote, this is all in your head. I'm going to put you on a antidepressant or an anti-anxiolytic or a medicine and see what happens in the next 3 to 6 months or so. What do you think is going to happen to that patient?
Wow.
A disaster, okay? So these are the big things that I see in my private practice over 44 years, okay? It's just incorrect testing, incorrect information, and women are suffering. They really, really suffer in that window from 32 to 51.4 when they finally reach their menopause. We're talking about 19 years of suffering unnecessarily or misdiagnosed, okay? And I'm not pretending to know everything. I don't. God knows everything. I don't, okay? But people need to know that these things exist. People need to know that they need to ask their doctors not to pop them on a pill or a birth control pill, do some hormone levels for God's sake. And more importantly, you have to do hormone levels from days 18 to 21. That is perfect timing. Days 18 to 21 of a menstrual cycle for you to see a clinical picture of what really is going on with that poor woman, okay?
Wow. I want to do this. Dr. Rosie, you can go on, and then I want to bring Dr. Prasad in because I know Dr. Prasad I know he's having comments or he wants to make some comments about the information that's been shared. So Dr. Rosie, go ahead.
I
Can we
want to
spotlight,
say, yeah, that's why it's so important for us to embrace these products, to have those good nutrients. Because if we look back, we have to know that it's in the foods. It's in the foods that we eat that we're not getting the minerals, the vitamins, we're not getting what we need. Because men back in the day at 90 years old, they was potent. Women were not having these issues, so because they were not eating the foods that they're eating now. Oh yeah, they were good to go at 90, 95. They were having babies at 70 that was healthy. I'm real serious. Talk to your grandmother, talk to some people you know. It wasn't no such thing as a man 40 can't get it up. What?
Okay, let's hear what Dr. Prasad has to say, Dr. Rosie. Dr. Prasad, You've been listening to this conversation. Tell us what you think.
Well, I mean, I'm learning a great deal about from Dr. Rosie and Dr. Lizards. But here is my, general thought. Like Dr. Lizard mentioned and Dr. Rosie too, that why you become like that, young age or old age, why you become so sick? Well, like you mentioned, that poor diet plays a role, poor lifestyle plays a role, and also environment. So all these three are toxic environment. We can't avoid it. We are living with it. But what they do so that you get so sick, you have to know that. And then you can devise a plan how to do it. And man and woman have to be equally healthy in order to have a intimate relation or enjoyable sex, for example. And so now the question is that what these environmental factor, poor nutrition, poor lifestyle does to your body, biochemically speaking. They increase the oxidative stress and inflammation. These two things there. First, they increase a lot of free radicals when then oxidative stress occurs. When this oxidative stress occurs, it damages the cell. And if the cell cannot repair the damage fully, because as soon as cell damage, they try to repair it. But if they can't repair it, then chronic inflammation sets in motion. Now you have two culprits: increased oxidative stress, chronic inflammation. And then increased oxidative stress messed up mitochondrial function, messed up all the biochemical stuff that are needed to cause, say, Alzheimer's disease or Parkinson's disease. So those two are main culprit. And sooner you downregulate it, the better it would be. So how you do it? Micronutrient, like Dr. Lizard and Dr. Rosie was saying, micronutrient, we have EFF. They have been tested clinically in animal model. They reduce oxidative stress and inflammation, as well as it increase the immune function. This is very important to remember to prevent any future infection, for example. So three things they do, micronutrient. They take care of the reduce oxidative stress, that environment, poor diet, and all these things create problem and inflammation. Then another thing, so the question is how we can maintain a good quality of life during aging and reduce the risk of chronic health issue, any kind of diseases. Well, for that, you have to also consider not only micronutrient, which is very important, but also intestinal dysbiosis, the health of the intestine is very important. Mm-hmm. And the 2500 MD, probably Dr. Lizard, both of you know it, Dr. Hippocrates, I can't pronounce his name, 2500 years ago, made a statement. All human diseases begins in the gut. And I'm talking in quote. But after that, everybody forgot that issues. And when the microorganism was discovered in GI, so now we have intestinal dysbiosis is the major player for your poor health and progression of all kinds of diseases, including cancer. And so what is intestinal dysbiosis is? Number of harmful bacteria increases in your gut, because in your gut, all the time you have a beneficial bacteria, harmful bacteria, but you have mostly beneficial bacteria. That is very important for your health. So when intestinal dysbiosis occurs, number of harmful bacteria increases, we call them intestinal dysbiosis. And that plays a very important role in initiation and progression of all kinds of human diseases. So this is very, so how do you correct it? Well,
so Dr. Prasad, let me do this. Before we're going to talk about all of the products. I just wanted you to jump in for a minute. I want to bring Dr. Lizardi and Dr. Rosie back so they can share a few more points. Then we're going to bring you up so you can share this amazing product line that they're talking about. Okay.
I will.
All right. So just hold on that information. Dr. Rosie, Dr. Lizardi, you just heard what Dr. Prasad said. What are your thoughts?
Well, the doctor, when we talked earlier, you mentioned about omega-3. So I wish you would expound on that, because it's such a critical product for us to be on. and most people never thought about. So could you share that, what you shared with me?
Of course,
Can I do it? Can before we do that, can we do it a little differently? So Dr. Lizardi, I want you to answer that question, but we also want you to share the products that you share with your patients in your office and why you were so comfortable doing that.
couple of things. The person who said health starts in the gut is Hippocrates, number one. What I wanted to emphasize was very, very, very simple. Like Dr. Prasad said, inflammation, okay? Inflammation is the root cause of every disease on earth. It's as simple as that. Most of the patients that have GYN problems, I already said, it's inflammation and estrogen excess. And the combination that I use in my office for cramping, particularly, is the omega and the CBD. And it works absolutely phenomenal. Absolutely phenomenal. But I want to repeat and emphasize, you need to check the hormones. You need to check the root cause of the problem while you give these people the omega-3 and the CBD for their comfort, okay? One word of caution, you can't take more than 4,000 milligrams of omega a day because it may enhance bleeding, okay? So don't just take omega blindly, do it under physician supervision and never exceed 4,000 milligrams, okay? I'm gonna give you one statistic that is gonna blow you away. Omega-3 is anti-inflammatory. Omega-6 is pro-inflammatory. The ratio should be about 2 to 1, 3 to 1, depending who you read. In the US, is 20 to 1. It is sick. It is absolutely sick how inflamed we're making ourselves from simply eating and consuming the wrong things, okay? So what do you think is gonna happen to the 16, 17, 20-year-old who comes to the office who eats McDonald's hamburgers every day? She's grossly inflamed. So what I'll do is I'll check the hormones, check everything that I need to check, but at the same time provide the omega boost and the CBD combination. And so far, it's been absolutely spectacular results, okay? All right? You can also do a thing called omega index. You should ask your doctor to do an omega index on you so you can determine your risk for sudden cardiac death. Because if that level is less than 5.7, omega index less than 5.7, you will increase your risk of sudden cardiac death at any time, at any age, okay?
Wow. Wow. Okay, Dr. Rosie?
Well, I am impressed with the products because of the energy that you get, and I understand the importance of circulation. You know, every body function better when you have proper circulation, and that is a key factor. And also, I know that there are a lot of women when they look at self-esteem, sometimes they don't think they're beautiful if they don't have hair, or if their hair is falling out. So I love collagen. When I started taking the product and added the collagen in, and Corleen, you remember, I mean, I don't have a whole lot now because I cut it off, but I had a whole lot of spots, okay? And that doesn't make you feel good. And after doing this product, I thought it was so important because when I see little girls now at 5 and 6 and 7, where parents are putting braids in their hair, and I feel so sad for them because they will never feel beautiful if they don't have hair, if they start at an early age like that. So I'm on a crusade also to help women to feel better, because when you feel better about yourself, your self-image, you're more sexy and you're more sensuous. That's true. I know y'all don't want to hear me keep talking about that, but it's the root of the problem. The people that I counsel, when they get to the very end, they come in, it's money. We don't have enough money. We got too many bills. When it all boiled down, Dr. Prasad, it's about what didn't happen or did happen in the bedroom. So I'm going to stay on this bedroom journey so we can have more happier people, happier children, and a happier community. Yes.
One of the things that I'd like to interject, like Dr. Prasad said, it's really, really important, is gut health, okay? Our gut is our second brain. Our gut, we're 80%. You have 80% of your immune system is in your gut, okay? I don't meet too many people in my practice with a dysbiotic or out of control gut, okay? If you fix your gut, your brain's gonna feel better.
Yeah.
Use the omega for anti-inflammation, your brain's gonna feel better. You're gonna be
Yeah.
better high esteem. It's all connected. That's the thing that people don't understand. Everything is connected.
Connect.
The brain and the gut are talking to each other all day long. Probiotic boost.
Yes.
Phenomenal product to get that gut going, okay?
Yeah,
So
that's the only way.
you have a brain boost, for God's sake. I mean, all the product that this man put together are spectacular.
Yes.
Give it some brain boost. Fix the gut, give it some probiotic boost. Get inflammation down with the omega. La,
Yeah.
la, 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 la. You see what I'm
And tell me this, what does gut health has to do with body odors?
Everything,
All right, that's what you're talking about.
everything, because this is what happens. Your liver is the biggest organ of detoxification. When the liver is so congested that it can't do anything else, guess what? All those toxins are going to come where? In your skin.
Mhm.
If you get a skin condition, you better think something wrong with your liver. Okay? All right? Everything is connected, my friend. And this product line that this man put together attacks every single area of
Yes.
every single patient in my practice.
Say
what-
that again, Dr. Lizardi. Say that part again
Every
about the product.
that this genius put together attacks every single area in the body of people and patients in my office.
Yes.
Period. That's what I'm going to say. Okay?
Thank you. Thank you.
So look, look, this is so
Tony,
good.
let
And
me
I'm
say
getting,
one thing. If you
Okay,
had
go ahead,
everything you need with the nutrition and the gut health, you wouldn't even all this cosmetic that people buying, you wouldn't even need deodorant.
You better believe it. All right? I don't know.
because we're naturally beautiful people, right?
Yeah.
And you wouldn't need deodorant because you wouldn't have odors. You wouldn't have to do that.
We've been using the word oxidative stress. And what I explain to people is very simple. Take an apple, cut it, expose the apple to oxygen. What happens the next morning? It's
Brown.
okay? It's the same thing, that process that's going inside your body. Your body's getting brown and
Yeah.
rotted, okay? So get your nutrition under control, get your act together, and stop oxidative stress. Your inflammation will go down. You'll
Yep.
feel more beautiful, and you have the best sex in the world when you go home with your husband at night.
We got okay. So look, here's what I need to do. I have 2 testimonies that I want everyone to hear. And then Dr. Prasad is going to go over our products. You guys, this has been such a great call. Time is just going so quickly. So just stay with me. Miss Kamalia, can you come forward? Let's spotlight Kamalia so she can give her testimony. We'll get hands and all of that. Just give me a minute. I need to do these 2 testimonies, and we need to let all of our guests know the products we're talking about. Dr. Prasad, we're going to hear the 2 testimonies, and then you're next. All right, Kamalia, let's do your 1-minute testimony. Let's go.
Okay, real quick. All right, I've had fibroids, uterine fibroids for years. I'm 75 years old now. And my doctor wanted to do surgery because they have gotten larger and larger, and my uterine line got thicker. I was introduced to this product by Dr. Picola 2 years ago. The next time I had my ultrasound done, the fibroids had shrunk and my uterine lining returned to normal. So no
Wow.
hysterectomy for me, no surgery at all. And I'm blessed. I don't get that pain or that bloatedness that I had before.
Yeah. Dr. Lizardi, what do you think about that? You're not surprised, right?
Not in the least, okay? No, I'm very happy for you, my friend.
Yeah.
Happy for
Very
you.
happy.
Yes.
Thank you, Dr.
Very-
Prasad, for creating
Thank
this incredible supplement. I appreciate it. Thank you so much.
Thank you.
Very good. And then, of course, I had to have a gentleman come up. And when I heard this gentleman's testimony, I just really couldn't. I mean, it is so wonderful. Horace, can you please unmute yourself and open your camera and share your testimony? It's just amazing. Wait till you hear this, Dr. Rosie. Dr. Lizardi, just wait. Okay, there he is.
Yes.
All
How's
right.
everybody? Good. I'm Horace Donnell. I'm 86 years old. I'm a survivor of 2 heart ailments, and they put me on Entresto. They put me on Eliquis. They said I needed blood thinners. And so after a month of being on the blood thinners, they took me to Myrtle Beach because they wanted to find out. I learned that Eliquis and Entresto damages your liver and your kidneys. They wreak havoc on them. So I went and they tested me. So I played dumb. I said, okay, what am I here for? They said, well, we just want to make sure you're okay. So when they did the test, they said, you are asymptomatic. You don't have any symptoms. So you're good. Your liver is good. Your kidney is good. And he says, the medicine is really helping you. I said, no, not your medicine, doc. That's not working. I said, it's these micro daily products that I'm taking. So they said, what micro daily products? So I named each one that I was taking. So he said, well, you know what? You got to be very careful because these are quacks out here. I say, you're calling this brilliant man a quack and you don't even know him? I said, that's like me going somewhere telling somebody about you that you're a quack. And they said that you are an excellent cardiologist. So this man is a brilliant scientist. I said, doc, let me tell you, I will stop taking your medicine before I stop taking my micro daily products. But before that, I didn't have much of a life. Last year, I didn't think I would be alive today. My life was so miserable. I walked with a cane. I walked bent over. I couldn't straighten my body up. If there wasn't a wall or a chair somewhere close by, I stumbled. I would fall and hit the floor, and then I would struggle to get up. Well, I was introduced to these products by Bernard Dean. He asked me to check my, I told him, no, I done tried everything. I am not interested in doing other products. So he said, you need to try these products. Well, since I knew Bernard and trusted Bernard, I said, okay, I'll give them a try just to get rid of it. I tried the products. I actually bought them from my wife because she was in a boating accident and she missed her back. And when she came home from work, it used to bring tears to my eyes because she would struggle to get in the house. She would come in, take a shower, and go straight to bed. That was it. And so she started taking the micro daily products. I started taking the micro daily products. 3 days after I started taking the micro daily products, I saw some change in my life. And my skin has started to turn dark because of the poisoning of the medicine that I was taking. My eyesight was poor, and I didn't have much of a life at all. My wife would say, let's go somewhere. And I would say, no, I'm just too tired. I don't feel like it. After a month on these products, my life started to change. I got rid of the cane. I started to walk upright. Eyesight cleared up, and my skin, as you can see, started clear up. I'm not dark anymore. I'm brown skin because of micro daily products. Those micro daily products, we ran out. And that was the most miserable time of my life, waiting to get my other products. Boy, those pains and things came back with a vengeance, Dr. Prasad. But once I got those micro daily products and started taking them again, my life totally changed. I owe my life to God and to micro daily products. And I will never be without those micro daily products. They are awesome. And like you said, diet, Dr. Prasad, and the micro daily products, I went from 275 pounds down to 225 now.
Wow.
Awesome.
Wow. Amazing. If you're a guest, I want you, somebody told me they got on a call and they were like, that stuff can't be true. You guys have to be paying people until they bought the product and they used it. And then they actually came on a Zoom and apologized to us. They were so just amazed with the outcome. So here's what we have to do. And we're getting real short on time, you guys. Dr. Prasad, Linda, can we bring up the products so Dr. Prasad can quickly go through the products? And oh, by the way, I have a special guest on the line, so none of you guys can leave. I just want to tell you that. Okay, Linda, can we see the products? And Dr. Prasad will talk about them.
Sure, give me just a moment to pull those up, okay?
Okay, who is that? Let's watch the mute. Okay. Okay, while we're waiting for that, what did you think about that testimony? Those testimonies are
That's
awesome.
amazing. That's amazing.
Yeah, yeah.
That's amazing.
And so, Dr. Prasad, when you created this product, did you ever in your life
Not in one
think that
dream.
you would hear these kind of
You know,
testimonies?
you did all the trial, everything, but in a mass scale like that, it is impossible. My
Yes.
hair stands. I don't have a hair, but it stands. I get emotional.
Yeah, yes. And by the way, if you're a guest on this call, I just want everyone to know that Dr. Prasad will be celebrating his 90th birthday on
Yes.
January 9th, you guys. Look at 90.
Wow.
January 8th.
Look at that right there. Okay. 90 years old looks really wonderful.
Wow.
So while we're waiting for the products, Dr. Rosie, okay, here we go. Let's see. Okay, so Dr. Prasad, we're gonna quickly go through the products, okay? So let's
Yeah.
start with our basic product, the
Yeah,
EMF.
micro daily, we already discussed its function, and we are in two forms, either you are capsule or hydro. Hydro is effect is same, but many people don't like capsules, so they can have a hydro. And as I mentioned, this is a must for reducing oxidative stress and inflammation in your body. And so next one is what?
Next one is our probiotic, which is our basic, right?
probiotic
Those are our
daily. We
standards.
discussed that this will reverse intestinal dysbiosis, which is responsible for initiating and progression of your not only aging, but also all human chronic diseases, including cancer. So you must reverse the intestinal dysbiosis, and it occurs in old people with or without disease. And so this is utmost important. It is important. So next one is Omega Daily.
Next.
Probiotic
Okay.
Omega Daily is also very important, as Dr. Lizard and Dr. mentioned, that it is a very strong anti-inflammatory. But one of the most important also function is that in the brain, the omega-3 has a two component, DHA and EPA. EPA is very important for your heart, and DHA is very important in your function, for your brain function. 40% of the fatty acid in your brain is DHA, because in membrane structure is there, and this is very important. You can imagine how important omega-3 is for your brain function. That's why it is called essential amino acid, but your body does not make it. You rely purely on diet or supplement. And next. Next is the collagen peptides. This is a patented formula, as you know. Collagen peptide, people ignore it. One of the 30% of your total body protein is collagen. That means it is present in every organ in your body, not only in the skin, but heart, brain, kidney, every place. So when you lose hair in the skin, you notice it. But when you are losing collagen from your brain or heart, you don't notice it. But one of the main functions of the collagen in your body is to maintain the structural integrity of all your organs. And if you lose it, the structure becomes abnormal and you lose its function. And this was demonstrated in one of the Alzheimer's disease cases, that they put the 90 days trial of collagen peptides, one group and another group got placebo, and 90 days. And they found with the MRI that certain area of the brain was shrinking. And of course, Alzheimer's people have a memory loss. And after 90 days, they notice again MRI, the structure improved. In 90 days, you can imagine, and also memory improved. So this is very important for you maintaining the function and the structure of all organs. So this is absolutely essential for your health. And then for another collagen peptide does that, even in cases of diabetes, for example, where the enzyme called DPP4 increases in diabetic cases. And when that increases, the flow of insulin from pancreas to the blood decreases, and then you have a problem.
Dr. Prasad, I have a question on diabetes. What's the percentage of people that have diabetes?
Oh, I think there's I can't tell you right now percentage, but huge number of worldwide, not in America.
Yes,
Huge,
yes,
huge number of people.
yes,
And
yes.
I think I would want it to 1 in every 3 Americans have a diabetes, I think, but
Think
I'm not
about that.
sure.
And we have people that have used our collagen product and their
yeah,
AC1, and it's better. It's better. So
it is better. And so that was clinical study. So it is very important. And there was actually a clinical study done in case of diabetic people. One group were getting a diabetic medication, another group was getting diabetic medication plus the collagen peptides. And you can see that the medication group got a glucose of 125, but combination group together got 105. So it markedly dropped it. A1C was like a 6.8, it drops to 5.8. And so, insulin sensitivity also increased. So this is very important. Collagen is so important from many, many point of view.
So Dr. Prasad, what you just described to us, the 4 products is what we call our core 4.
Yes.
Right. And so your suggestion is for ultimate health that people start on the core 4 unless they have cancer.
Yeah. Core for collagen is no for cancer.
Right.
But
now I think, right, go ahead. I'm sorry.
No, for cancer, you have to have a high dose micro EMF, not the low dose that we have. High dose is very important. And the reason you know that the reason is it blocks the cancer cell require glucose and glutamines for survival. High dose antioxidant, not low dose, high dose antioxidant blocks the uptake of glucose and glutamine, and cancer cell will die. And if you're getting a chemotherapy and radiation work by different mechanisms. They produce a lot of free radical, cause damage. And so they will enhance the effect of radiation therapy and chemotherapy while protecting the normal tissue.
Right.
This idea, nobody has done a clinical study as yet, but many people who are taking this kind of interim protocol, and it is a patented product. And so that is cancer is a totally different issue. But
so we're not going to do cancer tonight because I wanted to, but I do want us to talk about our CBD, because I heard Dr. Lizardi.
CBD is so important, and Dr. Lizard mentioned it.
Yes.
So
go ahead.
It has some function and nothing. It is safe. It's completely safe, FDA approved. And so here is the 3 things that it does. If you have anxiety, depression type of, have a problem, then that means your neuron has less serotonin. And what CBD does, it increases the serotonin level by 2 methods. It increases the synthesis of serotonin inside the cell. Second thing, it inhibits the reuptake of serotonin. And there is a FDA-approved drug which also does these things like inhibits the reuptake of serotonin, just only one function. And they are used to people who have depression and anxiety, like in PTSD, for example. And so one thing. Second thing it does, it is also an agonist of dopamine receptor called D2. And when you stimulate dopamine to make cell more dopamine neuron, you feel happy, relaxed. Second, very important function. Third is it also reduces the release and production of glutamate. And glutamate, as you know, excessive amount of glutamate is very damaging to the cell. It causes hyperactivity or behavior changes. So it is the only agent which can do all those 3 functions. And also another function of CBD is it stimulates the endocannabinoid system, and then it works through the various receptors. They do different things in different ways.
Yes. So I want to do something else because we're running out of time. I'm trying to get as much in as I can. Thank you, Dr. Prasad. Let me see. If I bring Jeff Ashby, Jeff and Helen, can you come up real quick? I'm trying to get all of this in, you guys. There's so much. This is so good. We also have Boost products, right?
Yes, yes.
Absolutely.
So, Helen and Jeff, can you quickly talk to us about the Boost products?
Oh my
Do you want
goodness,
to do the
yes.
Boost, or just go through them real quick?
Just really quick, that by
No, not
by
that
all
one, the other
standards,
Boost
I know,
products.
It's like, where do I start? Heart Boost is just off the charts. I mean, it was our most recent presented boost. Just absolutely amazing. You got to get back with whoever invited you on the call tonight and ask about Heart Boost. It's just that amazing. We've got digestive enzymes, digestive boost that was mentioned tonight. We've got brain boost. We've got eye boost. CBD is a boost product, and yes, there we go. We've got all of these. Thank you, Linda, for pulling those up. It's just amazing. And when you get one of the bundles, you can get just serious amounts of money, up to $45 off of any of the
Yes.
Boost products. And so
Yes.
really, it's just, we don't have time to cover them all tonight. We have to do this again. This main
Yes.
panel, this is just amazing. I sent Dr. Lizardi a text just saying, my phone is blowing up with people sending me
Yes.
private messages.
Yes.
Grateful.
Yes.
Yeah, Dr. Rosie,
Yes.
Dr. Lizardi, and
Yes.
Dr.
But I have one, but wait,
our
I'm not
favorite Dr.
finished.
Prasad. Yes.
But wait, I'm not finished. I'm not finished. I have another special guest. Can my other special guest please open up your mic and your camera, please? I have another special guest, you guys. I'm so excited.
Hello,
Okay.
Corleen.
Where are you? I don't see you. There he
I'm
is.
right here.
Look, there he is. So this is Mr. David Nemelka. David Nemelka is our CEO. And he and Dr. Prasad have worked together to create this wonderful, wonderful company called Engage Global. And I am so excited to be a representative. And if you're a guest tonight, I'm telling you, you have to get these products in your body. But David, you told me that you had a big announcement that you were going to make tonight. What is it, David?
Dr. Lizardi, first of all, good to see you. Thank you so much for your education. I think that everybody got a absolutely amazing education tonight and insights. Dr. Rosie, thank you for your passion and bringing health and goodness to the world. My goodness, and I love how you have the health and goodness is reflective of love. And I think love is one of our core values, and it's love at every dimension. So thank you for bringing that. Obviously, my partner, Dr. Prasad, couldn't ask for a better partner. And Corleen, yes, we've been running a special buy two, get one free on the CBD. And Dr. Lizardi, you talked about how important the CBD. Dr. Prasad, I know that you've done something very special with our CBD and the research. And so I want to announce tonight, we're going to run that special. It was supposed to expire tomorrow, but we're going to run it for an extra week. So we're going to run the buy two, get one free and make a little more Merry Christmas to everyone. Everyone, you've got till December 16th at 6 p.m. to get some CBD and stock up for the holidays, stock up for the coming new year. That's almost an $80 savings. So yes, tonight I'm announcing a little Christmas cheer, and we're going to extend the special savings on CBD.
That is excellent. Dr. Lizardi, I have a question about CBD for you. So when we were talking about cramps and heavy periods and all of those kind of things, and you were talking about younger girls starting their menstrual cycles and all that, what's the age limit for CBD?
I use 12 as a cutting age for most things.
Okay.
By 12, you're considered, quote unquote, a medical adult. So I feel reasonably safe providing either that or other medications or supplements after age 12.
Okay.
Yeah.
All right.
But remember, always
Yeah.
guidance of a physician, okay? You should consult with a physician first Just because these nutritional supplements are powerful, extremely powerful. So you can't just take without discretion. That's what I'm saying. Okay.
Yeah.
Okay. So what happens to the person, just like Horace, when he shared his testimony, he said the doctor said, oh, don't take that stuff. Because so often, I mean, you're open and we're grateful that you are. But how do we deal with those doctors that just go like, I don't want to hear it?
The proof is in the pudding. It's as simple as that. Okay.
Okay.
There are some people that are, and I don't blame them, they've been trained to basically make a diagnosis, put you in a little box with a name so that they can give you a pill. And I don't have any problem with pills. I want to emphasize that. I'm not an anti-pill physician. An antibiotic given prudently can save your life. Second, I did 10,000 surgeries in my life. I'm pretty sure that I saved a lot of life with God's help, okay? So surgery can help you and save your life, so can a prudent medication. So this is not an anti-medication propaganda, okay? But what I'm saying is, when you have somebody who's skeptical or non-receptive to nutritional targeted supplementation, my advice, go somewhere else. Leave.
All right.
That's not the person for you. That's my opinion.
Yeah.
Okay. All right. So then I have another question, and that is, first of all, people are saying how much they enjoyed this panel, right? So thank you all for saying yes. Thank you, Dr. Rosie, for saying yes, Dr. Lizardi. Thank you, Dr. Prasad, for saying yes, and for all the work you've done. They want to do it again.
Yeah.
They want to do it again. You guys, can we say yes, we can do this again?
Yeah.
I just think the title, do you guys like the title, the OBGYN and the relationship expert? That's just such a great tie-in. Yeah. So let's do it again, because we've been here a little over an hour, and you guys know I can do real long calls, so I don't want to be abusive. But what I would like to do is I would like to have each of our panelists give their closing words. So let's start with Dr. Rosie. Are we going to start with you because you're our lady on the panel?
Okay, I just want to say to everyone who's on the product, just encourage the people that you know to try it for 90 days. That needs to be your push. Just give me 90 days. You have tried everything else you've been on, whatever you've been on for 25 years. People brag about how long they've been on their high blood pressure medicine, how long they've been on this. So just give me 90 days. You've tried everything else, tried 90 days. And not just try to get them on the system so they can get to real benefit, not just one product at a time. Get them on a system for 90 days, and I truly believe you will have a customer forever. And when they ask, how long do I take it? Ask them, how long you been taking this other stuff you've been taking? Oh, I've been taking this 20 years. All right now.
And
90
Dr.
days.
Rosie, I want to say this. You said something really important. And so our basic bundle is going to be the micro daily and the probiotic. The other products are boost, you guys, because sometimes people want to just get the boost products, but you need to have the micro daily nutrition. So let's start with a basic bundle, build that bundle. I love, Jeff reminded us that, each time you add a bundle, if you're on a subscription, you're going to get the first one, $10 off, the second one, $15 off, the third one, $20 off, right? And reward points and all of that. But if you're a guest, just get back with the person that invited you, and they will tell you exactly what, there it is, the bundle strategy. So our basic bundle, and then those are the different bundles, and you see how you can build a bundle. You can build what your body needs. So thank you for that. Okay, Dr. Rosie, thank you. Dr. Lizardi, I am so glad to meet you. I have met you on our website, but
Yes.
meeting you in person is much better. So let's hear your closing statement, please.
Yeah, nutrition has been ignored. The worst enemy that you can have is ignorance, okay? If you don't know, you just don't know. It's as simple as that. I would rather use a supplement line like this with 7 patents and 14 scientific studies proving that they do what they claim to do, then go into any store and you're starting to pull things out of the shelves blindly. I mean, it's just plain old logic, okay? There's a lot of taboo, a lot of misinformation, a lot of misguided statements. I'm a scientist. I'm a clinician. I'm a very analytical person. The proof is in the pudding, okay? And if I have some product line with proof to back up what they say, end of the conversation. It's as simple as that. And not only that, I've tested these products in my own private practice. It's unbelievable. All right. I can tell you one story after the next, after the next. So let's go with science and facts rather than hearsay and mumbo jumbo. Okay. That's my statement.
Yes, yes. Thank you. Dr. Prasad, what would you like to say as we close tonight?
Well, that for your good health during aging and reduce the risk of poor health in future health issue, I think if you take micronutrient, at least the basic bundle, and like you said, as you go along, for example, heart boost is so important for blood circulations. And so if somebody needed that kind of a right away, I think that would be good for them. So all the additional supplement that we have, you can go on adding. And I really learned a great deal from Dr. Rosie and Dr. Lizard, their knowledge and their what they're getting in practice that encourages me a lot. It gives me extra energy to do some more.
Yes, yes, yes. And that's the wonderful part. Dr. Prasad is always doing more. So let me see. David, don't leave. Horace, your hand is up before we do our close. Before David, your hand is up.
Yes. I started out with Dr. Prasad's Choice back in the day.
Me too.
And that worked. And the products were excellent. Then I went to the Core 4. I always remember some certain things that Dr. Prasad said that I keep to the side. He said, if you take the Micro Daily products the way that they're supposed to be taken, some amazing things will happen to your body. Well, some amazing things have happened to this 86-year-old body. Thank you, Dr. Prasad.
All right, all right. Mr. David Nemelka, let's hear your closing statement, please.
Well, I just want to thank everybody here for joining us in our mission to bring health and goodness to the world, because clearly we are doing that. And tonight is another expression and example of that. My heart is full of gratitude. My heart is full of excitement. Dr. Prasad, your dream of ultimately touching literally hundreds and hundreds of thousands of people with your products in your lifetime of work, it's happening. Thank you to everybody who is here. I like what Dr. Rosie said and what Dr. Lizardi said. The proof's in the pudding. Give Dr. Prasad's products 90 days and the proof will be in your pudding. So enjoy the products, experience the products. And the beauty of it is it's not extravagantly expensive. At Engage, you can for $2 to $3 a day experience enhanced health and gut health and micronutrient health, upwards of $7 to $8 a day. You could get an even more complete health benefits. So I want to wish you all a happy holiday. Thank you for having us. And yes, let's do this again. What a fantastic panel. And we're educating people to be able to be more healthy. So thank you.
Yeah. And I want to say this. I want to say your body is your best investment. Mm-hmm. Your body is your best investment. Dr. Lizardi said, it doesn't matter how great you look on the outside if the inside is not good. Let's work on our insides, okay? I think that our 2025, let's work on our insides. And I'm going to suggest to everyone, because New Year's resolutions, everyone wants to do this, this, and the other. Order your product now so that you'll be ready for 2025. Okay.
Orlean, let's come alive in 25 in every way.
Let's come alive and absolutely. I just want to thank everyone for being with us. We'll let you know the next time we do it. I'm telling you guys, this is really, really important. Healthy bodies, healthy relationships. Thank you for being with us. I wonder if Fulvia is on, because Fulvia has a real special message all the time. Miss Fulvia, can you unmute yourself?
Yes, I can. And I
can we
just
see your picture? Can we see your picture tonight?
There we go.
Yes, we
I just
can.
want to
Okay.
let everybody know that I love my micro daily family. Yes, I do.
All right. Good night, everyone. I don't know. Is Daryl on with us? Who's
Mr.
gonna do
Wallace
the
is
let's
on.
go?
Mr. Wallace.
Oh,
I'm
Mr.
on.
Wallace. Mr. Wallace.
I love my Michael family too, and let's go.
Let's
Yeah,
go.
Love it.
Good night,
Yeah.
everyone.
Good night, everybody.
Great.
Good
Night,
Good night, everybody.
Make sure you get back to the person that
Thank
invited
you,
you. Get your product
everyone.
order.
Thank you.
Good night.